Breast cancer is a diagnosis that strikes fear in every patient. But when the patient is a man, the fear is compounded by confusion. Many people do not realize that although breast cancer occurs mainly in women, men have breast tissue and can get it too. Symptoms of breast cancer in men are similar to those in women. Most male breast cancers are diagnosed when a man discovers a lump on his chest. But unlike women, men tend to delay going to the doctor until they have more severe symptoms. The advanced imaging specialists at Florida Hospital Waterman and their Board Certified Radiologists use the latest diagnostic technology to screen for and diagnose breast cancer in men.
You know, it started off as kind of a little bit of pain, irritation in my right nipple. Then I began to feel a lump. As it got worse, there was some leakage, seepage of that sort of thing. I ignored all that.
Men with breast cancer will present in a similar way to women. The thing with men is that they think it's not breast cancer. They're not worried about breast cancer and they're not thinking about breast cancer. So they tend to present much later and it takes a long time before they finally show up at a doctor with a complaint.
I had been dealing with skin cancer, slow growth skin cancer, which is an ongoing battle, especially if you live in Florida. And I mentioned to the doctor that something was going on with my right breast. He looked at it and immediately took a biopsy of that and told me I needed to go see someone immediately.
The primary thing that you worry about is a lump. So if there's a palpable lump, particularly a lump that's not getting better or that's getting bigger, then that should send you to a doctor to get worked up. Other things would be pain, skin retraction or inversion of the nipple, a sore that doesn't heal, swelling of lymph nodes in the armpit. Those are the kind of things that you would look for. Very similar to women. We have a mammography center and 90+% of our patients are women. We have a separate waiting area for men so that they're a little bit away from the general flow of the women patients. But once a man gets in, he's treated the same way. We get 2 views of each breast. We always do both breasts because that way you have one to compare to the other. It's a very straightforward procedure. You come in, you take off your shirt, very easy for guys, and they're done standing up typically, and the machine comes in and compresses the breast, and we'll compress the breast top to bottom, and then we'll compress the breast sort of side to side on a bit of an angle, and we take 2 views of each side. They're done with digital technique now, so they're very fast. We don't have to develop films anymore. And those films are reviewed, and then depending on what they show, they'll very often go get an ultrasound for more information.
When you first get that diagnosis, like everybody who gets the cancer, it's a shock. So you go through a period of time going, is this true? This can't be right. I'm gonna die, I'm not gonna die. I mean, you go through many emotions. They immediately gave me a mastectomy. So from the time I found out I had cancer to the time I had the mastectomy was weeks, literally weeks.
Mortality rate is directly related to how early we catch it and what stage it is. We stage things typically 1 through 4. So the higher the number, the more disease and the more the disease has spread. So for men and women, if you catch it early, the mortality, the survival rate is very, very high. The problem for men is that we catch it later because men don't come in and present as early as women do. They don't get routine screening and only present when there's a problem. So being aware, being alert, and getting on these things quickly is the most important thing for both men and women.
I would tell people, they go, oh my God, Rich, you have cancer. What kind? Breast cancer. Men get breast cancer? Really? Yes, I have breast cancer.
Breast cancer is about 100 times less common in men than women. For men, the lifetime risk of getting breast cancer is about 1 in 1,000. The number of breast cancer cases in men relative to the population has been fairly stable over the last 30 years. This year, over 2,500 men are expected to be diagnosed with breast cancer. If you'd like more information about Florida Hospital Waterman's advanced imaging technology and board-certified radiologists, please click the Men Get It Too story link icon on our homepage, yourhometownhealth.com.